Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about the continuation of the previous video where the medical monitoring system for the chronic disease patients has been seen. Okay. Here we are going to see about the telehealth integration, that is beyond monitoring to holistic care. We just don't need the monitoring alone. We just need the next step. The next step is the caring also. Okay, beyond monitoring we need the care also. Here we can have the 4 categories: tailored messaging, interactive apps, virtual consultations, and phone follow-ups. Okay, first is tailored messaging. We can personalize the messages, what all the factors we are going to identify, and how how we'll get a vital parameter data, right? That data can be texted to the healthcare advisor, where he can see that and educate the person. And next is interactive apps. We can use smart tracking apps. By using that, we can identify where the patient is found. Okay. And the third one is virtual consultation. Consultation. By using video conferencing or something like that, we can connect with the patient or the hospital doctors. We can clear the doubts what we have. And then the phone follow-ups also. By using phone calls also, we can rectify, or we'll be able to ask what all the doubts we have and how the healthcare to be analyzed, that can be taken care of. Tailored messaging. What is called tailored messaging? Personalized text reminders and educational content delivery at optimal time. Okay. See, now we are going to analyze a heart rate of a patient. Okay. After analyzing the heart rate of a patient, that data what we are getting, right, that can be given as a text message to the clinical tester. Okay, that is called the tailored messaging. Once he sees the text, he'll find whether it is in a correct range or not. If it is not, he'll be able to reach out the patient and treat what he wants. Or else, if the range is normal, that will be fine. Okay. Likewise, we have a second one is called interactive apps. Patient's portal for symptom tracking, medication logs, and self-management tools. Symptom tracking. What are the symptoms we have? We have very different kind of symptoms for different diseases, right? According to that, we can track. Will be given in that app will be given all the data of the patient. Okay. If we get this kind of symptoms, what the disease should be. Okay. Likewise, the app will be added. It will be added with a few informations about the patient. Okay. Once if the patient is getting a different range of heartbeat range, so it will give an alarm that the patient is not good. He has some disturbances. So that alarm will be given to the clinical tester. Tester will be able to analyze what is happening, and he'll be able to treat him. Okay, that is the thing. And the next one is a virtual consultation, where we can consult a doctor in a video conferencing. Likewise. Okay. And next is phone follow-ups. This is similar. For any medications or any doubts clarification, we can call them and assist what we want and ask what we want. Telehealth combines remote patient monitoring with virtual visits, educations, and self-management supports. Virtual visits, education, and self-management supports, creating a comprehensive care ecosystem that enables lifestyle changes and early interventions. These all together, that is virtual visits, educations, and self-management supports, these all together will able to create a very comprehensive healthcare ecosystem, where it enables lifestyle changes and early interventions also. Okay. Next, Overcoming barriers, technology adoptions and system integration. What are the technology adoptions? Workflow integration, patient education and multidisciplinary teams we need. Okay, workflow integration, patient education, and then multidisciplinary teams. What is workflow education? Seamlessly incorporating remote patient monitoring data into existing primary care workflows and IT systems remains a critical challenge. These remote patient monitoring is also incorporated with the regular primary data, where it will get the IT system will be jammed together to, it will be in a very critical stage where which data belongs to which patient or something like that. So what we are going to do is we have to take a separate workflow to the patients of the remote patient monitoring systems, and the separate team for the patients who is having a daily care who is visiting the hospital daily. Okay, patient education, tailored training and ongoing support helps patients of all technology comfort level engaging successfully. Okay, what we are going to do is we are going to supporting patients daily. Okay, the technology of all technology comfort levels, which enables to a very successful one. Okay, multidisciplinary teams, that is nurses, pharmaceuticals and specialists works together to optimize chronic disease management and care coordinations. Okay, these teams, that is, we not only need the clinical assistants, we need nurses, physicians, paramedicines and specialists of a specific disease who works together and optimize these chronic disease patients management and care coordinations also. Okay, real world successful story. How does this happens? Okay, exceptional engagement metrics, efficient care escalation, measurable clinical impacts. These are the main thing. Patients taken vital and impressive 22 days per month on average, demonstrating stronger adherence to monitoring protocols. 22 days per month taking the vital parameters continuously will demonstrate the patient, will tell the patients that they are perfectly all right in all the spaces, where 22 days perfectly they are monitoring their body, right? Only 0.2% of vital encounters requires escalation to physicians. Only 0.2% of a patient has been directed to the physicians to showing what all the difficulties they have when they can be treated as such. Okay, measurable clinical impact, significant improvements in hypertension and heart failure management combined with substantial cost saving through reduced hospitalizations. These hypertensions and heart failure diseases, right, these has been managed to the remote patient monitoring system, and whereas the cost saving has been done to the hospitalization persons. Okay, this is how the remote patient monitoring system and a medical patient monitoring system has been specifically used for the chronic disease patients. Okay, this is the annual chronic review. How does it take place? Patient intervention, lifestyle assessment, medical reviews, complication screening and personalized care plans also. In future, how it is going to be, it will going to be incorporated with the AI, Internet of Things and proactive care too. Okay, first we are going to, it will be incorporated with the AI and then Internet of Things, and then it is a proactive care. It is going to be a very huge thing in the near world. Embracing remote monitoring to revolutionary chronic cares. How the patient's care has been team collaboration, patient engagement, measurable impacts, and technological integrations. These are how by you incorporating all these four parameters, we are going to take this system to a next extent, okay, where it will be a very big one to help these chronic patient diseases at a remote patient monitoring, by using a remote patient monitoring system. Thank you.